Hello, this is Dr. Robert Bouvier, and you were sent here to listen to this video to learn a little bit more about the primary care paramedic. Let me say that again. The primary care paramedic. It's also known as the medical paramedic or the community paramedic. So, you know, most paramedics are take care of emergencies. They drive around in ambulances, and they help people that are in dire need in emergencies. And they're the people you'll want because they're the ones who can really take care of a true emergency. 24/7, 365, you know, anywhere on the road, home place, on the job site. We know that this EMS, this emergency medical service system, use for paramedics has been well established, and that's not what we're talking about today. We're talking about a second use for the paramedics that are basically under the umbrella of primary care physicians and some subspecialists. So basically, what is a primary care paramedic? Basically, they're an extension of the physician's office. So why the physician's office? Because that's where the need is. In our community, in most of our communities across the United States, we have this thing called the continuum of care. People in the hospital, out of the hospital, going to specialists, going to the lab, x-ray, etc., etc. But there's this wedge that's been missing out of this continuum of care, and it's taking care of sick patients at home, keeping them out of the hospital, emergency department, and responding to an urgent need before it turns into an emergency. Nobody's really been able to fill that spot. And if you think about the paramedic, they are the absolute perfect person for it. And I was thinking about this, and really there's three elements to the paramedic that make them the perfect person to help the primary care doctor tidy up this continuum of care. And here's the three elements. Number one, they're available 24/7. Number two, they work in the homes and job site, right? And they are the best physician extenders for sick people. Basically, they're the missing link for healthcare delivery today. Another way to put it would be the primary care paramedic is the missing link in the so-called continuum of care. Okay? So, why are paramedics best suited for that? Why are they the best physician extenders for that job? Basically, to be a paramedic, you have to have a special mindset. Okay? And you have to have a skill set that is really not with any other form of healthcare. No other group of people have this mindset and skill set that the paramedics have. They're used to taking care of the sick patients. They feel comfortable in emergencies and urgencies, let's call them. So they feel very comfortable about the COPD patient, the lung patient, the heart patient, the vascular patient, the diabetic, the non-emergency / emergency patient. They feel comfortable. They're home at this kind of patient. When the critical issue is going on, they're the ones you want taking care of somebody. The problem is that when somebody gets sick, or maybe 12 to 24 hours before they get sick, they can't access their doctor quick enough. They can't always go into the emergency room, because that's what we're trying to prevent. But the paramedic is around 24/7. They're used to working in the home, and they have this mindset, the skills to be able to handle those issues. It's what the primary care doctors like myself, internists, and family practitioners, and then some subspecialists have been looking for, and the community paramedic, the primary care medic, the medical paramedic really fits well. The reason we want it to be a medical paramedic because we already have a really good emergency medical service. That's not what I'm talking about. That's already being taken care of. This is using the paramedic in a medical way, and we have to keep the two separate. The two shall not meet because it's two different things, two different needs. So how do we deliver that? Well, obviously the paramedics will be servicing patients in their home and maybe even on the job site. The training needs to be kind of upgraded a little bit to correspond to some of the primary care needs, and we've set up a meeting with one of the local colleges, and they're setting up a curriculum as we speak to train them. In the meantime, we are giving classes to help train them, as well as a blog that the paramedics can log into, and every 2 days, every 4 days, somewhere around there, I'm giving a little pearl of wisdom from a primary care standpoint, so that can add to the skill sets of the paramedics that we'll be using. In addition, the primary care paramedics will go through a certification process to help them kind of ratchet up their healthcare expertise from the primary care standpoint. So if you have any questions about the primary care paramedic, I would go to drandyu.com, drandyu.com, and find the question and answer stuff about the paramedics. And if you are a paramedic and you want to sign up for the blog to get further education in this, then by all means email me at robert@robertbouvier.com. That's ROBERT at ROBERT, B as in boy, OU, V as in Victor, IER.com, and I will add you to the list of YouTube videos and the blog that we are producing at this time. Again, this is Dr. Robert Bouvier for the Primary Care Paramedic Understanding, and if you have any questions, please get a hold of me. Again, have a great day. This is Dr. Bouvier from Dr. and You.